Welcome back. It's now 5:30. Some local hospitals have recently put tighter visitor restrictions in place to keep everybody safe. IU Health now says Methodist and Riley are allowing just 2 visitors per patient.
And that is down from 4 visitors that they had in place just a few weeks ago. And one of the reasons for the change is what they're seeing is this unusually high spike in a virus that typically we see during the winter. And it typically affects our young children and vulnerable babies.
Now, we talked about this back in July, but tonight our Dustin Grove learned in some communities it's actually gotten worse.
3-year-old Ryder is back on the bike after a tough few weeks.
What happened?
He got a little cough.
She had a little cough.
It started with a fever.
And then a few days later, a very runny nose, sore throat.
And a trip to urgent care confirmed it was RSV.
I was a little surprised just based on the timing. Nobody gets RSV in August.
The respiratory virus that primarily affects kids normally strikes in winter, but this year doctors and hospitals started seeing cases in July.
We started seeing some cases pop up and we were like, well, that's kind of unusual. And then from there, it just kind of exploded.
In Kokomo right now, an unprecedented spike, sending vulnerable babies to the hospital. And in Indianapolis, too, where we met newborn twins Kennedy and Harper just a few weeks ago.
You know, it can be very rapidly evolving. One second they look fine and the next second they're just not fine.
This summer, doctors at Riley Hospital for Children seeing up to 5 cases a day. So what's behind the surge? Doctors think it may be that last winter, during the height of the pandemic, people were home, hunkered down.
And so I think the exposure wasn't there to allow it to kind of take hold and run its normal course.
Now kids are back in the community.
Is there any concern about what this could mean for the winter? As we're seeing more COVID cases, more RSV now, is there any concern about a strain this winter?
There's definitely concern for a strain. You know, that's always the pediatrician's fear of that, you know, that perfect storm of multiple viruses all at once.
The message to families?
You know, if your kid is sick, please, please, please stay home, because once that RSV gets into the daycare, it spreads like wildfire.
Thank you.
After 3 weeks, the virus has run its course through the Westhouse home.
We are feeling much better.
And Ryder is back to running his normal course.
Good to see Ryder doing well. Now, RSV causes cold-like symptoms that can make breathing especially hard for infants. Other symptoms include a cough, runny nose, sneezing, and a fever. You treat it the same way you'd treat a cold unless your child needs oxygen. Be sure to call your doctor, though, if you do have any questions or concerns.